Today, we are going to look at a BodyViz brain builder about the respiratory system and a tracheostomy. The respiratory system is a group of organs that help you breathe through gas exchange. The respiratory system consists of the nose, nasal cavities, paranasal sinuses, pharynx, larynx, trachea, bronchi, bronchioles, and terminal bronchioles, all which lead to the alveoli within the lungs, which is where gas exchange occurs. In this brain builder, we are going to focus on the respiratory structures within the thoracic cavity, starting with the trachea. The trachea is considered a conducting pathway, which are structures within the respiratory system that are not directly involved in gas exchange. Conducting pathways include the nose, pharynx, larynx, trachea, and bronchial tree. The functions of these structures in this zone include providing a clean passageway while humidifying and warming the incoming air. The trachea descends within the superior mediastinum of the thoracic cavity and ends in the posterior mediastinum. At its most inferior point, the trachea divides into the right and left bronchi, which enter the lungs at the hilum. Each lung is shaped like a pyramid with an apex mediastinal surface, costal surface, and diaphragmatic surface. Each lung possesses an oblique fissure, and the right lung possesses an additional fissure, termed the horizontal fissure. The two fissures of the right lung divide the lung into three lobes, upper, middle, and lower. The single fissure of the left lung divides the lung into an upper and lower lobe. The conducting and respiratory pathways within the lung branch repeatedly, forming the bronchial tree. With each division, the diameter of the conducting and respiratory pathways decreases, and the surface area increases. The conducting pathways do not participate in gas exchange and consist of the primary bronchi, segmental bronchi, bronchioles, and terminal bronchioles. The respiratory pathways are the thinnest and most delicate branches of the respiratory tree. They have incomplete walls and participate in gas exchange, with blood through a rich capillary network surrounding them. The respiratory pathways include the respiratory bronchioles, alveolar ducts, alveolar sacs, and alveoli. The alveoli of the lungs are small sacs of simple squamous epithelial cells. Next, let's learn about a tracheostomy and then look at a patient example. A tracheostomy is a surgical procedure that creates an opening in the anterior trachea in order to control respiration. Often, a tracheostomy is required in an emergency to allow breathing when someone's airway is obstructed or damaged in an accident. More commonly, a tracheostomy may be performed in order to assist mechanical ventilation or to wean an individual from a ventilator. Next, let's learn about how a tracheostomy is performed. Typically, a local anesthetic is applied and the patient's neck is slightly extended so the trachea can be palpated. A horizontal incision is made immediately inferior to the thyroid cartilage of the trachea. The thyroid gland is gently moved inferiorly, and the larynx is stabilized. A tracheostomy tube is then inserted into the lumen of the trachea, and the tube is secured in place by 2 or more sutures. A tracheostomy is typically performed in order to prevent or alleviate respiratory failure. Some common causes of respiratory failure could involve one or more of the following: a coma following a severe head injury or stroke, a condition that damages the lungs, such as pneumonia or cystic fibrosis, any condition that causes paralysis of one or more of the respiratory muscles, or a condition that damages the nervous system, such as Guillain-Barré syndrome. Finally, let's take a look at a patient example. You're working in the ER when a patient from the airport comes in. You receive the patient's file and take a look. Age 67, gender female, chief complaints shortness of breath, chest pain, rapid and irregular heartbeat, coughing, and fainting at the airport. You enter the patient's room and she is conscious and laying in bed. You ask her questions about the events leading up to her feeling ill and fainting. She explains that she has been away on a business trip in Australia and was on a 25-hour flight home when she began feeling ill. She said around the 18-hour mark of the flight, after not being able to get up and walk around much, she began feeling cramps in her right calf that would not go away even after she tried massaging it. The pain in her calf kept intensifying, and the skin became red and warm. When her flight ended and she was exiting the plane, she found it very difficult to walk and began experiencing shortness of breath, chest pain, a rapid, irregular heartbeat, and coughing. When she was trying to get to baggage claim, she fainted. After listening to your patient's lungs with a stethoscope, you hear rales, which are small clicking, bubbling, and rattling noises in the lungs. You ask your patient if she smokes, and she reports that she has been a smoker for the past 20 years and was diagnosed with COPD 2 years ago. COPD stands for chronic obstructive pulmonary disorder. You observe cyanosis of the patient's lips and skin, deep to the fingernails. You diagnose her with respiratory failure, secondary to a deep vein thrombosis that dislodged and traveled to her lungs, causing a pulmonary embolism. A surgery is performed for a tracheostomy to be placed with a long-term treatment plan. This is a classic example of a tracheostomy. Want more 3D anatomy videos like this one? Like this video and subscribe to our BodyViz channel.